Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
What is postpartum depression?
Postpartum depression refers to depression that occurs within the first year after having a baby. It occurs in 1 in 7 women, and 2/3 of postpartum depression actually occurs before the birth of the child. It's very common that women experience depression during pregnancy, and then that leads to postpartum depression.
Is there any category of expecting mothers who are more at risk?
Yes, there are several risk factors for postpartum depression. The biggest risk factor, or something that would put women at risk of having it, is a personal history of major depression or of having postpartum depression. Other things that put women at risk are having stressors in their lives, an unplanned pregnancy, having a traumatic experience that's going on currently or in the past. Financial difficulties can also increase risk, and substance abuse, so abusing alcohol or drugs, can also increase the risk of postpartum depression.
What are the warning signs that a mother might be in the early stages of postpartum depression?
Warning signs of postpartum depression include women not feeling themselves. Often women can experience lack of energy, they may not sleep as well as usual, they also may feel bad about themselves, they may feel worthless, they may feel guilty about things that they have or haven't done. Women often also their self-esteem can be affected. And sometimes when it becomes more severe, women may have thoughts that life isn't worth living. And it can really physically affect women, where their appetite can also change and their sleep can change. Another very commonly thing that women can experience is depressed mood. And they may feel low, and typically it's more days than not.
What can fathers do?
One of the most important things is that the best thing a mom can do for herself and her whole family is to get help. And if the father can help the mom get that help and let them know that this is common and that getting help is the best thing she can do for her and her baby, and help her get to a medical provider or to a psychotherapist who can provide treatment, the fathers can have a really pivotal role in this and helping mom get the help she needs.
How can you help a mother who's going through this?
The most important thing to do is to reach out to her medical provider, and the medical provider can then do an assessment and help determine whether she may be depressed or experiencing emotional struggles. And there's several effective treatment options. The mainstay of treatment is psychotherapy, and also other treatments include medication options. That includes, antidepressants, for example. That can be used either as an alternative to therapy, or it can also be used in addition to therapy. And other support options and treatment options include, it's really important for women to take care of themselves. Exercise can be helpful, having a healthy diet. Other complementary treatments like yoga can be helpful. And one of the really key things is just for women to realize that getting them help is the best thing they can do for themselves and their baby. Another really important thing for women to realize is that, we all have stressful situations in our lives, and often we can't change stressful situations, but what women can always change is how they're coping with that stressful situation, and therapy can be extremely helpful in that, because it can help women learn how to cope with having a new baby, or with the perhaps marital difficulties that come up with having a new baby. There's a lot of stresses involved. Having a baby is always challenging, and it's important for every mom to realize that she deserves support.